And again, welcome to our Kirby Virtual Expo. Some of you may have attended our Kirby Expo that we have held in our auditorium each year. And unfortunately, due to COVID restrictions, we're unable to do that. And we're conscious of your health and safety. So we're doing it virtually this year. We hope to welcome you all back in the auditorium next year. Over the next 2 weeks, we'll be presenting a series of online presentations by some of Calgary's leading providers of information and services, featuring a wide range of products and topics that will help you maintain a healthy and rewarding lifestyle and to live your best life. Today, we're very pleased to feature Vytality and welcome co-founders and co-presidents Nicole Dyer and Brad Lohman to help us explore options to age in place. Mr. Lohman is a registered psychiatric nurse and has completed his Bachelor of Nursing Science and Masters of Nursing Health Administration. Through his career, he has been key in the design, development, and the clinical operations of the Alzheimer and Dementia Resource Clinic through Alberta Health Services, as well as the operation of the Geriatric Assessment and Support Clinic and the Community Geriatric Team through the Primary Care Network. Brad understands the complex clinical aspects of mental health and those of seniors, having completed over 10,000 assessments during his 26-year nursing career. He can provide insights and strategies to help seniors and their families preserve their independence and age in place. Ms. Dyer has worked with seniors and within senior living since 2003. In 2020, she was named as one of Calgary's top 40 under 40 in the 2020 Avenue magazine. A graduate of the University of Calgary, Ms. Dyer's accreditations in both economics and human resource management helps her to balance an organization's efforts between their most important resource and largest expenditure, their team. During her career, she acted both in-house as well as consulting on senior housing plans, service offerings, expansions, and staffing models. She is well-versed in options for aging and an advocate for ensuring there is choice in the market for these requiring assistance. And thank you very much for joining us this morning, Nicole and Brad. Please tell us about your programs and services and the technology that you offer at Vytality that can help us to continue to live at home with peace of mind.
Thank you. So I think we'll get started in our presentation as we have a lot of information to cover. So why don't we get started there, Colleen?
Absolutely.
So what we're going to be covering today is, for those in the audience, tools and strategies to stay at home, technologies that allow us to stay safely in home, social and communication technologies, looking into the future, and we're here to help. So as we age, unfortunately, there are things that arise for us that can put us at risk for staying in home. And I wanted to review some tools and strategies that are well established for those who want to remain in home safely and happily. We recognize that medical follow-up is critical for one's health and wellness. And in my experience, it's very, very important for those who are aging to follow up with their family practitioner at least once a year to get a baseline and understand if there's any medical challenges that are evolving or causing them increased challenges. This can include osteoporosis, mobility challenges, cognitive disabilities, diabetes, Parkinson's, etc. And as we age, there are more risk of developing these aging syndromes, which again, a family practitioner is well equipped to identify and support you in understanding what is taking place. The other key element, which much of the research surrounds, is particularly with COVID, we've noted within our organization that clients have become increasingly isolated in their homes due to the fact that families and friends were not safe to visit due to COVID restrictions. And this has really resulted in seniors' isolation and increased rates of depression and anxiety. It is very, very critical for those who want to stay at home and remain safe and healthy, that getting out of their home and doing regular exercise, if they are not at risk for falls, is very, very important. Doing range of motion exercises in their homes, again, to increase blood flow and some of those positive feelings when we exercise. The other key element is socialization. And again, as mentioned during the COVID challenge, isolation has been a key issue for those who live in their homes. However, technology has been useful in some of those areas, as with FaceTime or looking at Zoom. That's very important to engage family and friends through those applications. However, that really doesn't meet many persons in terms of how they engage people, because it's not as fluid as one-to-one or direct socialization. So what many of our clients have done is engage their families either in a backyard or in the front of their home and remain social distance. But socialization is critical, again, for our health and wellness and continuing to keep us cognitively engaged, as well as helping with our mood and anxiety. Health supplies can also be readily available through many people, such as Co-op or our partner, Assist Home Care Supplies. That is important, because if it's identified that you're needing healthcare supplies to remain in home, that these supply services are readily available and can deliver to your home to ensure that you get what's required to stay equipped. Because, of course, going out and being at risk and attending some of these stores, particularly with the continued COVID concerns, can be a challenge. But it's very important to get the supplies you need to stay in your home. Many people, as they age, they look at their home. Their home is their kingdom. And of course, everybody, for the most part, wants to stay in their home if they can stay there safely. Modifying your home, there are many, many agencies out there in Calgary currently that do a very good job of coming in and evaluating how your home is functioning. And they can determine which supplies or how to modify your home to ensure that you can remain safe in your home. Some of these ideas could be a stair lift or a chair lift going up your stairs, moving all your furniture, etc., onto your main floor, modifying your bathroom to ensure that there's no threshold in your shower, having a cutout in your bath to allow easy and safe access into your bath for a shower, putting up bars, raised toilet seats. The list goes on. But again, these companies are well established to look at ways of modifying your home to ensure that you can continue to cook well and manage independently. Community involvement, again, is a big challenge, particularly with COVID. And that is certainly reduced based on the fact of some of the restrictions that are in place. However, now that those restrictions are lifting to some degree, it is very important to get out and about within your community. It has been fantastic that our weather has been so mild that we are able to get out and get engaged. However, that being said, many of the community resources and centers are not operating at their full capacity due to the COVID restrictions. So visiting your neighbors or people in your community will also help you remain connected to your home. Being proactive is also critical. Throughout the course of my career, I've seen many clients and patients that have waited far too long before they do something to support their fall risk or to support their cognitive challenges. It's important, if you or somebody you care about or love, you've noted signs or changes in their health or cognitive function, that they do become assessed by a specialist or family practitioner or a healthcare provider that can engage them and understand what's taking place in their life and what those changes might be part of. Far too often, people wait till a crisis happens, a fall happens, or an emergency visit happens, and then they get help. So it's important to identify what's taking place if you notice any changes. Subsequent to that, if you do notice changes and things can be done, it is critical that you try to access any support services to allow you to stay safely in your home. That can include accessing Alberta Health Services and the public system, all the way to Vytality at Home as a private agency that can get out and really meet your needs on a daily basis.
Honing in a little bit more on what people have as far as options go when it comes to home care. Everyone in Alberta has the option of going and requesting for an assessment to be done through AHS case management that will allow them to access Alberta Health Services funded home care. Now, one of the biggest misconceptions that people have around AHS funded home care is that it's actually provided by Alberta Health Services. In all major centers in Alberta, all funded home care is provided by subcontracted home care providers. Calgary's largest subcontracted home care provider would be CBI. So most of the individuals that are being deployed to provide in-home care services are CBI employees who are managed by Alberta Health Services case managers. Since starting Vytality at Home in 2019, majority of our clients either currently access Alberta Health Services and augment their services with us, or they've gone through Alberta Health Services and unfortunately haven't found that the services are as they would like. And what I mean by that is Alberta Health Services is very regimented in what can be approved from a service perspective. They're there to provide hands-on personal care, such as shower assistance or medication reminders. And in the rare occasion where families have a loved one providing hands-on assistance, they may approve for a few hours of respite care. But outside of that, they're not equipped or able to provide any additional services, which really leaves seniors and their families in a challenging circumstance when it comes to looking to access additional in-home support, which may look like nutrition, so meal preparation or laundry or light housekeeping. What we found is a lot of individuals that access our services go through Alberta Health Services and then request self-managed care. So anybody who may be listening right now who's not heard of self-managed care, we welcome you to reach out to us. I'm happy to have a conversation about what those options could look like from a self-managed care perspective. When we look at the private home care space and into what we do specifically, our services are much broader and very focused on our individual clients' needs.
Yeah, and it's good, Nicole, pointing out the difference between AHS services and private home care services. And we can only really speak to our services at Vytality at Home and how we are very different. Again, it's very important to get a very comprehensive assessment, which we at Vytality at Home facilitate, which I go out and do every assessment. It typically takes between an hour, hour and a half, looking at the whole individual, their environment, how they're walking, how they're cooking in their home, transferring in and out of their shower, etc. And subsequent to that assessment, we are really able to target the interventions that are critical to ensure that person can stay healthy in their home. Many of those services that we provide are the typical medication assistance or reminders, personal care, helping our clients in and out of the shower and helping with hygiene and clothing assistance. Respite care for caregivers is also identified, given the fact that we do a caregiver burden screen, which can identify if a caregiver is overwhelmed and burdened with the support of their loved one. And that results in us putting in a very customized plan to ensure that the caregiver has their respite time away to do the things they require, and they can then remain either their husband or wife or daughter or son, rather than being the caregiver. We also obviously provide nutritional support where we put meal plans in place and actually prepare the meals for our clients. Light homemaking services are offered in most of our clients. And of course, the engagement is critical. And what we mean by engagement is really customizing our plan around how do we support that individual on their spiritual, cognitive, and emotional aspects. And we very focus on what activities we can engage our client in to really tease out some of their interests and re-engage them in some of the interests and hobbies that they once were partaking in, and get them re-engaged into those to provide a better quality of life. Dementia support is critical. A large percentage of our clients have some form of Alzheimer's disease or related dementia. And as a result of that, our team is very well trained in how to support and manage those persons who are impacted by that disease state. And lastly, coordination of services, we believe is critical. Over the course of my career, it has been incredibly challenging for most of our clients' families to help navigate the system and what services are required to ensure that they can stay safely in their home. Private home care and AHS services can certainly help support individuals to stay in their home safely. However, there are a wide range of services such as home care supply services, physio care, occupational health, social worker. There's many of which we have over 26 trusted partners that we've vetted personally to ensure that they can execute and provide the supports required to our clients. For example, we have a lawyer that is very focused primarily on ensuring that clients are being proactive with getting enduring power of attorney and personal directives in place, rather than waiting too long until some medical incident happens in which they do need to pursue guardianship and trusteeship. We also want to ensure that there's convenience services such as lawn maintenance or snow removal, dog walking services, which we can engage in quite readily. In-home health services, we primarily use Assist Medical Supplies because of their customer service. And we have massage therapists, we have physiotherapists, occupational therapists, and Rana Home Health Oxygen that we also encourage our clients to participate in if required. Again, many seniors who live in their home, it is a challenge to get out and get groceries, particularly through the COVID challenge. And we've partnered with Sunterra Grocers, and they're amazing. Obviously, their delivery service is fantastic in the sense that they deliver right inside the client's home and make sure they help put away the groceries. We have home maintenance services. We work with PCS, which is a response system for a fall alert pendant that many of our clients are encouraged to use as, it's not if, but when, if somebody has mobility or balance challenges that they may fall. So it's important to be proactive to have one of these pendants in place that alerts the families as they fall, which is very important because oftentimes if somebody falls, they may become unconscious, they may have a stroke. There's many incidents in when a person can't press the pendant, when in fact, this actually triggers a response if the pendant notices a change in that person's equilibrium. There's also a GPS attachment to that pendant as well, which many of our families who live abroad are very pleased to have because they can actually see where their mom or dad are at any time during the day in their home. We have pharmacists, Penny and Foster pharmacists, who do pharmacy consultation in our clients' homes, as many times seniors over the age of 65 are on 5 or more medications, which can have contraindications in terms of their medical presentation. And many times it's very important to have a pharmacist review what medications are required and how they interact with each other. We also work with the Alberta Neurologic Clinic, which has physiatrists and neurology who specialize in cognitive disability. And we work very collaboratively with them to ensure that our clients are treated in an expeditious manner and ensure they get the right treatment at the right time. We also are working with Dr. Ishmael through the Hotchkiss Brain Institute and looking at some research opportunities that he is moving forward with. So it's a very collective and collaborative approach, because we know Vytality at Home can only do so much to engage our clients and ensure that they can stay safely and well in their home. However, there's many other services that we can mobilize if it is required at any point during our engagement with our clients. Very important, there's a number of home care services and companies here in Calgary alone. And it's very important to do your research when you're looking at requiring some home care services. Obviously, AHS, there's a one number and you'll get a home care manager to come out and they'll do an evaluation. Each of the home care supports that are currently in Calgary vary significantly. Some have nursing support as part of their package and some do not. But these are some of the questions that it's very important to ask when you're speaking to any number of the home care providers in Calgary. Does the company have experience in operating a company? That is very important because it can be challenging operationally. Are their staff employed or contracted? So at Vytality at Home, all our team of just less than 100 are employed. And so that's important to know because, contracted employees, there can be some challenges regarding that. Do they have a nurse as part of the organization? Do they complete a comprehensive in-home assessment to determine the needs? In many cases, home care companies do very brief interaction, 10 to 15 minutes, and then determine that. So from our view at Vytality at Home, it's very important to do a comprehensive in-home assessment to look at the entire client and what they may be required to stay in their home from a proactive standpoint. Next, is it important to have technology to help coordinate and communicate with caregivers? Many of the questions and concerns our families and clients have is they really don't know what's taking place in their mom or dad's home. And that's very important to have transparent communication from that company directly to you in a timely manner. Thankfully, that's how we operate. We have a mobile app that many of our families download, and that allows the caregiver and the family to see when our team arrives, when they depart, and that also allows them to be able to communicate with our team at any point during their home visit. And then, of course, they receive a report after each visit to provide up-to-date information as to how mom or dad or their loved one is doing. Communication is probably one of the bigger challenges that many companies struggle with because it is so important. Families are reaching out to get support in their home for their loved one, and oftentimes there's a significant lack of communication back to them about how things are moving forward. Next, is it important, do they have a focus on social and cognitive stimulation? Many companies don't have that platform. So it is very important about that engagement with clients in their homes. Obviously, watching TV is not well received from many of our clients. So we really target specific activities that we can engage our clients in to make sure that they are stimulated cognitively and socially as well. And again, how does that company coordinate additional services and supports if it is required? From my lens, that is critical aspect of somebody who's aging, because oftentimes it's not just one element that you need to manage. There's many elements, and families often struggle as to know what are the next steps. We have a number of clients that are currently receiving 24-hour, 7-day-a-week services, and they're needing navigation of other supplies and supports. And thankfully, Vytality at Home is able to offer that based on our experience. But that is really important because you want to make sure that is a high stress environment when additional supports and services are required as your loved one ages.
Looking at some interesting technologies that are out there right now that allow individuals to stay at home safely. So we'll talk briefly about some communication and social stimulation products that are out there, some home safety and monitoring systems. We'll discuss some on-demand service and what those facilitations look like. And we'll quickly touch on some robotics. We could talk about robotics probably for a few hours. We won't go deep down that rabbit hole today, but stay pretty high level with some neat technologies that are pretty easy for installation and use. Starting with communications and smart devices. During COVID, it's become quite common for seniors and their families to be communicating, via Skype, Zoom, FaceTime, with the ease of use of an iPad. And so, that's quite common, but I think it's something important to have in place for most seniors. And there's a lot of great apps that can be out there that really allow for that use to be simplified, as far as pressing the button just simply to answer the iPad or FaceTime. Additionally, we worked closely recently with a company here in Calgary called Radley Robots. They're supplying an actual robotic moving platform that actually allows for individuals to call and have a virtual assistant on that moving iPad. They're doing current rentals here in Calgary as part of their trials, and have just finished a trial with a few different senior living and long-term care communities. They're really great as far as being able to trial something for someone who may be averse to accessing technology on their own, or being able to use an iPad necessarily on their own, because the robot can be in the home and trigger timelines to actually turn on and turn off to allow for that visual flow of information. We also have a lot of our clients that are currently set up with Alexa or an Echo Spot or Google Home in their house. It allows for direct connection for individuals to call into Alexa. So if you have it connected to your phone, then instead of someone physically having to pick up the phone, they can ask Alexa now to pick up the call. They can add additional grocery items virtually by saying, Alexa, add Depend products to the grocery list, or an array of different elements that can be added to that list. On the back end of that, family members have the ability to access that information. So they can actively monitor and see what it is that their loved one is putting onto those lists before anything is actually launched or ordered to that individual's house. And then, as Brad mentioned, the personal response system. So we work really closely with Priority Care Call here in Calgary, great local organization that provides in-home assessments and will really see what sort of personal emergency response system is best for each of our individual clients. In some circumstances, it's a very simple button that would actually deploy EMS. In other circumstances, it's a button that would call the family before it ever deploys EMS. In other circumstances, as Brad relayed, it could be a GPS function that allows family members to more closely monitor the location of their loved ones. So those communication and smart devices are really great. The most recent iWatch that's come out actually does a lot of these things as well. We find that a lot of our clients are a little reluctant to have that attached to their wrist at this point, even though it's a watch. But we believe that kind of the next generation of seniors will really benefit from that hands-on interactive technology. When we look at individuals' homes, one of the elements that we do suggest is a keyless door entry system. And one of the reasons why we look at that is we have a lot of clients when we've initially started services that start with with a lockbox system or a key box system. We know that those keys can sometimes go walking away. Sometimes someone forgets to put them back in the box. It could be the case that you have a few different individuals or loved ones that are going in to access somebody's home, and the key, or they forget the code, and so it can sometimes become a little bit of a challenge. some great and very easy technology. Kivo's come out with an electronic lock that can be easily put on. And we've actually just recently demoed a great lock system by August that actually is fully virtual. It retrofits over any sort of lock deadbolt and is fully virtual. So you can release virtual keys to individuals and effectively, as a family member, monitor every time the door has been open, closed, and who it is that's locked and unlocked those by name of who virtually has the key. So from a safety perspective, it is a great tool, and we're big advocates for a keyless door entry system. We also believe that in most of our clients' homes and loved ones as well, that we should have some motion censored lighting. Again, a very affordable retrofit that you can have, allows for, if somebody's getting up to use the washroom, to make sure that the lights turn on to help avoid some of the, the fall risks and mitigate those challenges that someone has. Flood sensors and stove guards are, again, a technology that really have come a long way. I actually just saw flood sensors sold in Costco the other day for a very reasonable price. So a great little tool that can electronically and technology-wise send messages to a loved one in the event that something's flooding. So not only to the senior who's in the house, but to the family in the event that something's taken place and they're not physically there. And then electric stair lifts. A lot of our clients who elect to stay at home and are being really proactive. There's some really affordable and great options for electric stair lifts that we work closely with a few different organizations to help roll those out. Another big element that we are huge proponents of are on-demand service offerings. And, it's wonderful when individuals have our team coming in on a daily basis to prepare meals. And a lot of our team members are specialized in meal preparation specifically for seniors. That said, we know that a lot of people still want to have an array and access to different foods. There's been a lot of great organizations that have popped up in Calgary that specialize in food specifically for seniors. But sometimes, that's not really the food that an individual wants to eat. They want to eat from their favorite restaurants, but maybe no longer want to go to those individual restaurants. So Skip the Dishes or DoorDash are two really great options that our team actually is happy to set up and work with our clients in order to, arrange for. We also work really closely with a company, again, local here in Calgary, called Mo Snow Pros. They can do on-demand snow removal or lawn care. The reason why we like them as being an on-demand service is a lot of our clients really love the fact that they can continue to do a lot of their yard work themselves. And some of them even enjoy clearing snow in the wintertime when safe to do so. But, sometimes someone's feeling under the weather and those things get backed up. So being able to literally push a button and have someone who's equipped to come out and provide those services is something that we really are happy that we're working closely with. Majority of the time as well, when we have clients that are going out to appointments, we're accompanying those individuals, but we're using Uber versus some of the other services. The reason behind that is the transparency. So Uber has a wonderful family sharing app that our team works well with. And the family sharing app allows families to invite our team member to be part of their Uber group. That sends family members notifications as soon as our team member and their loved one is out going to an appointment. So they can physically see and follow along on the map, knowing, okay, dad left on time, he's going to make it to his appointment on time, I see that they've arrived, and the same thing moving home. When we launched Vytality at Home, we quasi think of ourselves as a little bit of an on-demand service. So although we provide services anywhere from 2 hours intermittently all the way up to 24-hour end-of-life care, we've created the platform that really allows for individuals to access us similar to how they access some of these other platforms. So just to show you a little bit of a video here of how we're currently functioning and what our app allows family members to do.
Great. So just to recap for everybody, it's very important to watch for changes in your loved ones or friends as they grow older. Identify those changes and obviously have that individual seen by their family physician for further assessment, or a healthcare provider who feels comfortable working with that population. Stay healthy by engaging others, whether it's through Zoom or FaceTime, getting out and going for walks. It's very important, albeit in the winter, as you know, you need to be extra safe and careful. Be proactive in getting support and services to stay in your home, because many times we wait far too late as a population, and then sometimes it's too late and then there's no chance of you to return home. So that's very, very important. Understanding your options to stay in home, and obviously be proactive by looking at what are those options. Doing some research around which home care provider services are required to keep you in your home for the longest period of time. And definitely feel free to contact Vytality at Home for any help and resources or helping you navigate your situation. Thank you. And I guess, Colleen, we'll turn it over. We know want to leave some good time for any questions that the audience may have.
Absolutely. I don't know if you'd like to end your screen share, and certainly we'll open it up for any questions. I would invite you at this time, if you have any questions or any feedback at all, by all means, take advantage of the Q&A or chat button on your menu here. We'll be happy to get to that. In the meantime, wow, thank you very much, because that was a very informative presentation. And I myself really had no idea how full service your company, your organization is. And so I think it's a great opportunity for people and family members, loved ones, to be able to take advantage of that full service that you do offer. And I think a lot of people are a little bit concerned about inviting someone into their home to take care of them, whether it's the loved one making that arrangement or the person itself that's being cared for. Sometimes if there's some trepidation there about letting someone else into your home. So I think that app is a great idea, provides a great service, and the ability for family members to stay connected through the technology that you're offering, to be able to check in on what is happening, is taking place in their loved one's home, and how are they being cared for. So great options there. And the ability to be kind of a one-stop coordination of the services as well, I think is a great idea, because again, people have some trepidation about contracting other services, and are they reputable and will they do, but this way they're vetted by you and referred by you, and people can be comfortable knowing that they can work with them safely. So well done. Thank you very much for all of that great information. We've got a couple of questions coming in. Louise would like to know, what are the age requirements to take advantage of your services?
Yeah, good question, Louise. Really, we're quite flexible, albeit, it's case by case basis, and requires a conversation with myself or Nicole to determine, what your needs are. Typically, we have one client now who's 41. He has some significant disabilities due to a motor vehicle accident, and that's why he's reached out to us, because he's heard of our great service offerings. Aside from that, typically we're seeing those who are over 60 who have various medical challenges that they need help to stay in their home.
I think to hone in on that a little bit further. So our goal is really to assist seniors. So we get a lot of individuals that have been interested in accessing our services, under the age of, that senior age bracket. And we take those on a case-by-case basis. When it comes to our services, though, we really do pride ourselves on being very proactive. And what we mean by that is we can really tailor our services to the very young and very independent senior. And so our services range from, 2 hours intermittently all the way up to 24-hour care. So a lot of younger seniors that really are very active in their lives will access our services for our team to come in and provide, wash and cut their vegetables and their fruit, plate up those things so that they're in the freezer for them or in the fridge, that they don't have to do those things, unpack their dishwasher, do their laundry, the day-to-day stuff that really none of us want to be doing with our time. And then from there, we can grow our service offering as time evolves, or if somebody, has, any additional ailments, or even go in for surgery. We have a lot of clients that we assist just on a very short-term basis post-surgery.
And I think, some people may start out with just a few services, and then as they grow a little bit older, then they may need to take greater advantage. Louise has said, thank you very much for that answer. Betty, thank you very much for your kind words there. We do appreciate that. It's always nice to know that that people are getting value from these presentations. I'm sure we'll all be happy when we can do it again in a much bigger way in our Kirby auditorium again. But in the meantime, these presentations, such as today's, Nicole and Brad, thank you very much, are very important to our viewers. So we thank you for those kind words, Betty. And Carolyn would like to know, do you recommend only one personal emergency response company, or do you present choices?
So we work most closely with Priority Care Call. They are a local company here in Calgary, and they have an array of different products. So they don't only have one type of product, they have numerous different products, but they also own and operate their own call center. And so from our perspective, having worked with lots of different options that are out there over our terms of service in this industry, what we found is they're very personalized to the individual. So if we have a client that maybe presses their button 5 times in the course of the day, that call responder on the other end is aware of the fact that that's something that this individual does. Whereas, some of the bigger operators that are out there right now, the service isn't nearly as personalized. There's pros and cons to every service, but we work most closely with them.
It's and having that personal interaction. Some people just need to know that there's someone on the other end. So having that personal engagement, I think, is a great thing. Lois would like to know, how is the service funded?
So we are fully private. So it is funded either through the senior or through the family. That said, I would say that close to 50% of our clients at this point in time are funded as well through self-managed care. So self-managed care is a program that's through Alberta Health Services, that you are required to have Alberta Health Services home care. I believe at this point in time, it's a minimum of 3 months. And then you can apply for self-managed care. Self-managed care provides, I believe it's $25 for every hour that Alberta Health Services has deemed you needing services for. And that can be applied to any provider, so any home care provider or private care provider that a family wishes to access.
So if someone was in need of having some support in order to be able to access your services, they could go to the managed self-care and be approved, and then they could select you. Do you have a choice of the organizations you work with?
Yes. So AHS won't provide you with a list of individuals. You're on your own as the general public in sourcing out who you choose to use. We're obviously one of those options. We like to think of ourselves as the best option, but
So they would go to AHS, request a self-managed care, be approved, and then they could contact you, and then they get financial support toward the cost of, I'm presuming one would just contact you in order to get a schedule of fees or whatever that you would charge, so that.
Yeah, we're happy to take anyone's calls to get further detailed information. But yeah, essentially for self-managed care, the client would need to contact AHS. They would need to have a home care manager from AHS Then they would next have to request an occupational therapist to do the assessment. And then that therapist determines the number of hours that specific client would qualify for in order for self-managed care. The reason a number of people choose self-managed care is they want, the continuity of team members and consistency of an approach where, due to AHS being a public system, they often aren't able to provide consistent people. So we are able to do that and schedule those same people for sure. Yeah.
Something that if you would like to do, if you would like to pop your contact into chat and perhaps the link to the AHS self-managed if you can. Otherwise, perhaps after the presentation, if you want to send me that information, I'll send it out to all of the registrants. As I mentioned, we will have this up on our Kirby Center YouTube channel, but it takes a little bit to get it up there. So if anybody is interested in connecting with you right away, if you wanted to pop that into chat, people could jot that down. Or we can send it out to them afterward. Lena has asked, what is the cost to rent a robot? And what do the robots do for you?
So our last demo that we had with the robot, it can physically drive around an individual's house, no stairs or incline, so just on flat surfaces. And it can have conversations. So it can be a live individual on the other end. It can also connect individuals through like FaceTime or a communication like Zoom portal with family members, set up on like a specific time frame or with a virtual assistant that's making the calls. My understanding at this point in time, they're renting units locally for as little as $10 a day or $300 a month.